everyone, it's Dr. Glenn Vo, and I am super excited to have the president. He's the president, okay? This is not just some low-level management guy. The president of Nierman Practice Management, Jon Nierman. Jon, what's up, man?
Hey, Dr. Vo, great to be here. Thank you so much for having me on.
Man, I've been wanting to get you on for quite some time. And, the last time we saw each other, we were in Nashville. We were connecting with a lot of people. And I missed out, man. I missed out because I go to bed really early. But I heard that you, rocked it, playing the piano, right? What were you? Tell us about that. And we'll get into why I brought you on. But tell us about that, man. Tell us about this, other, side gig, this other passion you have, just musicians. So tell us about that.
Yeah, so we just connected at the dental festival in Nashville. We were hanging out there, and on Sunday at the dental festival, they had Sunday Fun Day at Tootsie's, which is a famous bar right in downtown on Broadway. And somehow I was able to convince Elijah to have me be one of the bands playing there. And so we did it was supposed to be an hour. We ended up playing for an hour and a half.
Wow.
And I actually flew my band out to Nashville just so we could say we played at Tootsie's.
Well, how was it? So as a music lover, as someone who's been in music for a long time, how was it to be playing at Tootsie's with your band?
Man, it was so much fun. And honestly, the best part wasn't even that it was at Tootsie's. That did help, but it was so cool being able to play in front of so many friends and dental people, and everyone was just having a great time, and the energy was high. And I'm looking out, and I know all these people.
Yeah.
And so it was really cool to mix those two things together. The dental with the music and the fun, and that's kind of what the dental festival, that whole vibe and the energy was about. So it was just really cool. But hey, now I can cross that off my bucket list too. So
now, is that a possibility of just continuing to merge that? Because I know you guys have events going on all the time. Is there a chance that maybe at one of the nights, or maybe near the end of the event, that you will make an appearance with the band? Is that something that might be in the future?
Yeah. So I've been trying to incorporate more of the piano into dental events whenever I can. But after that event, I put it out into the universe. I said, from this point forward, I'm going to play at every big dental event somehow. Maybe it's at a piano bar across the street, but I'm going to incorporate it at every event. And then what ended up happening was I connected. One of the next major dental events I'm going to is the AAPMD and AOSH collaboration cures in September. Wow. So September 15th through the 18th in Phoenix, collaboration cures. So the AAPMD event, and I talked to the president of that organization, and we go way back. And so he actually let me play at the reception. So now I'm going to be playing there too. Yeah. So that's
now, is there a way we can, is there a way that you can take some requests possibly? Maybe if someone signs up for something, maybe you'll accept a request or that for a song that can be played here.
Oh, I like it. Yeah.
I mean, make it a little bit more personal there, right?
Yeah. I think we could do something like that. Yeah.
I love it. Well, look, the reason why I brought you on is because I've known what your company has been doing. Your mom is a legend in this industry, founded this company, and brought you on to kind of lead it to the next level here. And so Nierman Practice Management, for those who don't know what you guys do, right? Not everyone's like me that kind of knows what's going on. For those who don't know what Nierman Practice Management is, tell us about it. What is Nierman Practice Management?
So
and actually, you know what I'm going to do is I'm going to share our screen real quick.
Oh, perfect. Yeah.
And there we go. Yeah. So
All
again,
right.
The big thing that I see is make it easy for dentists to implement medical billing and dental sleep medicine. So I'll let you elaborate right there.
Yeah. Well, thank you for sharing that. That makes my explanation even easier. And that's what we're all about. We want to help dentists incorporate and implement medical billing, and for dental sleep medicine, TMD, oral surgeries, and a lot of practices, they've been wanting to incorporate medical billing now because they see the benefits, and it's such a win-win for the patients and for the practice growth. And what we do is we streamline that process for practices. So we have education and training, we have software, and we have medical billing services and ongoing support to really take away the workload away from the team and into a streamlined, systematic approach that's going to give them everything they need to be successful when implementing these new, the medical billing. It's what I like to say is medical billing. It's not that it's difficult, it's just different. And the dental practices don't have those systems that are meant for that. So
I want to bring that up because there's so many companies out there, right? There's so many companies that do medical billing for dental practices. There's so many companies that teach it to you and say, hey, you can do it yourself, right? But I pulled this particular area of your website here, and I wanted to highlight it, right? 34 years of working here, and again, look, that's John's mom over there. She's the founder. It's not his sister, okay? And she's probably not going to like the fact that I'm going to highlight 34 years, okay? But why is it? I mean, why is that so important? Why is it so important to have that track record? And also, again, your mom's been in this niche for a long time, grew this company, and you're coming on and kind of taking it to the next level. Why is that so important?
Well, it all comes down to, and that's why I'm so passionate about what we do, is because I grew up, I'm actually the same age as our company as well.
Wow. So you grew up in this company, basically.
I did. I grew up, and it's like having a twin sibling, and you fight all the time, and there's all sorts of jealousy and other elements. And I like to say at our course when we do the introduction is, if you can't beat them, join it.
Yeah.
But that's really what is my passion, is carrying on that legacy, because I witnessed for my whole life how hard my mom worked to build not just the company, but to help these practices and really help this industry grow. And the industry being sleep apnea and TMJ specifically, because when dental sleep medicine and those appliances, they first started getting out, that's the biggest challenge that practices were having, was having those systems to get reimbursed easily by the medical. And so there's so many other elements that we help with when it comes to the dental sleep medicine implementation. But that's the core of it. If a practice has struggles, that's really where it was. And what my mom did, that is why we have such a great track record, is she worked with every single client. She would always pick up the phone, and she was really dedicated to ensuring their success. And so she has so many connections. We go to these dental sleep medicine meetings, and everybody knows her, from 30 years ago and 20 years ago. And that I've seen that my whole life. And I just think that that's something that I want to carry on too. I want to have that same impact, where, she'll have people come up to her and say, Rose helped me 30 years ago when I was first getting started out, and I don't know what I would do if I never worked with her. And she changed my practice and changed my life.
And I want to continue that and piggyback on what you just said there, because some people who are not maybe familiar with having medical reimbursement with dentistry, they're probably thinking like, what does that mean exactly? Why do I care? Can you just lay out what the significance is if you can, obviously, number one, get medical to pay, how that can change a practice, but not only change a practice, but help you take care of more people? Because that's always going to be the barrier. Like, okay, I know I do have sleep apnea, I do have TMD, I do have these issues, but I can't pay. But talk about the significance of being able to give people a way to pay and to be able to take care of them. How and talk about like some of the success stories you've seen with some of your own clients.
Yeah, absolutely. And it's one of those things that it's a tool that you can utilize to set your practice apart, increase that standard of care even higher, because you're going above and beyond now to make that treatment as accessible as possible for your patients. And for oral surgeries too, and bone grafts and related procedures, we're getting a lot of coverage for that too. So it's a great way to increase case acceptance. And what we're seeing now is patients are more aware that their medical benefits do have coverage for certain dental procedures. So they're the ones asking about it now.
Yeah.
And so now there's conversations happening where patients are saying, hey, can you check my medical for this? I heard that medical could pay for this. And if the practice isn't doing medical billing, that could be something that might make the difference between the patient moving forward or going somewhere else now. And that
they might go somewhere else that offers medical. You might be the practice that can solve that solution. They may say, hey, you know what? I like going to this practice, but they're going to cover it with medical. I might just go over here.
We're starting to see that more and more. And when it comes to the sleep apnea treatment, it's already like that because the sleep apnea appliances are covered at such a high frequency and percentage. Almost every single major medical plan has coverage for sleep apnea appliances. So there's really no excuse not to bill for sleep apnea, and patients that's what they're looking for. They're looking for a provider that can help them maximize their coverage and lower their out-of-pocket costs. It's huge.
Yeah. So Jon, obviously growing up in dentistry and seeing this, you've also noticed the mentality and the psyche of the dentist, right? So a lot of times dentists, and I'm sure you talked to them before, they're like, well, sounds good, Jon, but I want to know who you've worked with. I want to see the proof and all that. And honestly, I just kind of scrolled here and there's a couple of people who wrote some amazing, this Dr. Walker guy seems like he wants to, he would probably buy dinner for you every time he saw you, Jon. I mean, he seems so happy, but talk about the people that you worked with. And again, if some members are like, okay, well, I want some references. Well, what do you tell them? I'm sure you guys have plenty.
Well, being in business for 34 years, we definitely have a pretty great list of clients. And some of them have been with us for about that time, 30 years, 30 plus years. And I think that's really one of the things I'm most proud of is that longevity with some of these great practices. And we on the dental sleep side, we work with some of the early sleep dentists and some of the presidents and board members and past presidents of the major dental sleep medicine academies, Dr. Michael Gelb, Dr. Steve Lamberg. These are dentists that are big educators and big advocates for the movement. They're out there doing so many great things. And it's been an honor to work with them for such a long time. And we work with some other great practices on the oral surgery side where we're helping them build medical. And so you don't even need to be doing sleep apnea to benefit from implementing medical reimbursement. And on that side of things, we have so many great clients too.
Well, you brought up something that was really interesting that actually separates you guys from a lot of companies. You were talking about the education component, but we'll get there. I just kind of want to put this as a teaser for those who are watching here. And guys, I know you're probably wondering, is there a Nifty deal? Is there something going on? Just wait. We're not even done yet. Okay. So before I go into all the education and stuff, let me just go down here and I want to kind of clarify a couple of products that you guys have that, again, people may be a little confused about. So that is the dental writer software and also the actual medical billing service. So let's go over dental writer. And Jon, if you can just talk about that and talk about how that helps dental practices get their medical reimbursement rate up and accepted.
Yes. So Dental Writer, and our new software is Dental Writer Plus, because that's our new web-based version. We just launched that about 7 months ago. And it's been great. We rewrote the program so it's web-based and it's super user-friendly, and so it's an amazing program. What Dental Writer does is, what we like to say is it gets your ducks in a row when it comes to medical billing. And actually, that's our mascot. We have our ducks here, as you can see. And we have all kinds of ducks. And people, they love the ducks. I bring these to meetings and they go crazy for the ducks. They say it's for their grandkids, but they're taking a bunch of them. Like, don't lie, it's for yourself.
It's probably
their bath. It's all right. But what dental writer is going to do is it's going to streamline their documentation and their medical coding. So it's almost like an EMR specifically for dental sleep medicine, TMD, and oral surgeries. It's going to document all your clinical findings, the patient intake questionnaire, and then from there, it's going to auto-generate your SOAP reports of medical necessity. So that's what you need to back up your medical claims for these cases. And the way that Dental Writer generates these SOAP reports is it's all medical terminology. There's nothing really dental oriented about it that might red flag the medical insurance company and say, no, this is dental. Let's deny this claim. So everything is just backing up your case of medical necessity when it comes to dental writing. It's going to streamline that. Everything that we do is all about efficiency and doing things in a repeatable, systematic approach, because that's what you're going to need to implement this, so that it's not going to take time away from your other services and the team's, regular day-to-day duties, which I'm sure is already, people are overloaded as it is. Being able to utilize a software like this, it saves so much time, and it makes it so it doesn't have to be overwhelming or scary. You just kind of follow along step by step, and it gives you everything you need for those medical or those sleep cases.
Well, you were talking about how it's people are like, oh, medical billing is so hard. It's actually not hard. It's different. Yes. And because of the difference, you when you have a tool like Dental Writer, it makes that difference a little bit easier to work with, basically.
Yes, it makes it very predictable.
I love it. Okay, so so of course there's Dental Writer, which is the tool that'll help you get there, but then there's actually the medical billing service. So basically can we outsource to you guys and have you guys handle all the medical billing?
Yes, absolutely. And now with the new Dental Writer Plus, we have a fully end-to-end integrated solution with the billing service. So everything is all done inside of Dental Writer, and all the communication, the correspondence, the claim filing, the follow-up, it's all inside of Dental Writer. So you can communicate with your dedicated medical billing concierge that we set you up with, and they grab everything that they need from inside of Dental Writer. And it's a very seamless process, which again, that was one of the biggest pain points when it came to dentists trying to implement medical billing. If they were utilizing a medical billing service, what they were finding was it was still taking so much of their admin time to communicate and send files and play phone tag and gather up all the documentation and follow up. And that's what our goal and our vision has been with this new Dental Writer Plus and Nierman Medical Billing Service, is to make it extremely seamless. And so we have a whole team of medical billers. We have about a team of 16 medical billers that are part of Nierman Medical Billing Service, and they're all incredible expert billers that are dedicated to dental services. And the way that it integrates with Dental Writer, that's really what sets us apart.
Now, let's just address like the big elephant in the room. And people are like, okay, well, I'm going to invest in all of this, but how much am I actually going to get paid? The doctor's always thinking about ROI here, right? Just in your experience, getting a sleep appliance paid for, getting a bone graft, like what are the reimbursement rates compared to what you would get in dental, and why that is significant, and why you should invest right here?
Well, right away, for dental sleep appliances, there is no dental insurance for that. There's no coverage on the dental side. So, and on medical, we're seeing on average could be close to about $3,000 nationwide on reimbursement for those sleep cases. So the ROI is there right away on sleep. If you can do 3 to 5 cases a month in sleep, there's really not that much time involved, and it's such a great service to provide. It's I highly recommend, even if you don't want to make it a big part of your practice, start screening all of your patients, because then you're doing your due diligence, and you have a very viable, profitable business on the sleep side.
Well, and speaking of sleep, right? I mean, we have this sleep residency, and guys, I'm just letting you know right now, it's actually this weekend. So if you want to do this, you probably want to act really soon. But John, let's talk about why they should come to this mini residency.
So yeah, we're really big on the education and the CE side because it's all connected. That's been part of our philosophy since day one. And so we work with a great faculty of speakers, as you can see here. Thank you. So we have Dr. Michael Gelb, Dr. Steve Lamberg, and Dr. Anju Ely and Rose. They're going to be our main speakers for this program. And we're also going to have physician guest speakers. We have a sleep physician and other providers. We're going to have a myofunctional therapist. We're going to have an RPS GT talking about sleep studies. So this program is very comprehensive. What makes it different from other sleep programs is it is 4 sessions. So it's not just your 2-day intro course where you know enough just to be dangerous, and then the next step is you're kind of on your own. Our goal for this program is to have a pathway for practices so that they can stay on track and make sure that they get all of the key elements integrated in their practice by the time that they're done with this program. And in between sessions, there's research and articles and some homework and action lists that they can complete and then bring back case studies for the next session. So it's not just about the sessions too. Having those multi-session programs allows us to do more in between those sessions too.
Well, and that's the thing. That's again what separates what you guys do and what other companies do. You're incorporating the education, and again, the guys that are on this speaker roster here, I mean, they're legends when it comes to sleep, right? And so that should tell you something of how they feel about Nierman Practice Management. The fact that they would want to be Dr. Michael Gelb and Steve Lamberg being here and wanting to speak. That speaks volumes as far as what you guys do there. Okay, so look, Jon, you're in the Nifty Thrifty group, and I'm going to put you on the spot, okay? And I'm going to put you on the spot because everyone that kind of comes in, a lot of times they like to kind of slide in at the end to see what the deal is. Is there a special offer? Is there something you can offer our group as far as like the service or even this event? What can you do for our group here?
Yeah, I would love to. And what I'm doing exclusively for the Nifty Thrifty group is we're going to do 50% off their next CE course with
Wow.
Nierman CE. And so for the Mini-Residency, that would be for just one of the sessions, 50% off one session. But that's what's great about these Mini-Residencies too, is we're really flexible when it comes to attending because we know schedules are busy, and you don't have to take all 4 sessions. You don't have to sign up for all 4 sessions. So you can attend them a la carte, and the sessions are different enough where you can get so much value out of any individual session. And we live stream them too. So if
Nice.
People can't make it in person for one of the dates, but they do want to attend, we make that accessible too. And it's very, very interactive live stream, and we record them too. So that's our whole goal, is just to make the education accessible. So for the mini residencies, that's what we've done. And attendees for this program, you do get 2 sleep appliances made for yourself. So if you haven't had one made, you'll get 2, and you can do hands-on and make them for each other, and you can do the delivery and the adjustments. And that way you have the experience when you're talking to patients about what it's like to wear these devices. So that's another perk of this program too.
I love it. So right here, could they call this number 1-800-879-6468 option 4 to register? And so as far as to get the Nifty deal, they just let everyone know, hey, I want the Nifty deal, right?
Yeah. Just give the Nifty a shout out, and we'll honor it.
I love it. Jon, thank you so much, man, for jumping on. But hey, before I let you go, I know that you're a big practitioner of Brazilian Jiu-Jitsu. So I want to ask you for your advice here. This last event here, Paddy Pimblett, rear naked choke on Jordan Levitt. He's a BJJ black belt. And I want you to evaluate this technique. He did a body triangle and trapped his arm there. What are your thoughts on this technique here with Paddy Pimblett?
I can speak on this from experience because I've been in Jordan Levitt's position many times with the arm trapped and the body triangle, and that is just not a good position to be in. The body triangle alone is devastating. It doesn't look that bad, but it's crushing your diaphragm. So it makes it difficult to breathe.
Can't
So
breathe.
just being in that body triangle alone is not fun. Then you got the arm trap, so you can't defend the choke. And I mean, you're just.
I mean, this guy, he had no chance, right?
Yeah.
He had no chance, right?
By
So,
that
anyways,
point,
I wanted to throw that in there. I want to let everyone know because we actually have two dentists who are black belts and BJJ are in the group, and they're going to appreciate this, and they're also going to appreciate that Jon is a brown belt and BJJ. So, just to let you guys know who I'm talking about. That's another reason that you should come. Maybe you can go to the gym. Maybe you guys can roll or something. You guys know who you are.
Yeah.
There are black belts. You should come there and come because again, these two docs, Jon, they do a lot of surgery. They get into little sleep. So there you go. I mean, maybe you can take them to the gym like after the session or something. Maybe they can meet people at your gym.
Yeah, if they're black belts, I might find myself in that position again if they come. But
Awesome,
it's always great. Yeah.
Well, hey, I wanted to throw that in there, but hey, Jon, thank you so much for jumping on, guys. You know how to get the Nifty deal, okay? If you want to get into sleep, you got a sweet deal, 50% off. And if you want to learn more about Nierman, medical billing, dental writer, hey, what better way? Come to the course, talk to the man himself, talk to his mom, Rose, who is the founder of the company. I'm sure there's going to be other team members as well. Get your education on, figure out what they do, and then sign up. It's as easy as that. So, Jon, thank you so much, my friend, for jumping on. We appreciate it. We'll bring you back on soon. I have a feeling that more people want to see you more. So thank you so much.
Thank you so much for having me. This was great, and we'll see you next time.
All right, guys. We'll see you later.